very honored to be able to present the Harry J. Baker Community Service Award to the individuals and organizations who served on the Promise Healthcare Transition Board of Directors until the new operational board that governs Francis Nelson was formed. A little bit of background on this. The Harry J. Baker Award is intended to honor community members or organizations whose dedication and work toward improving the lives of people in our community exemplifies community service of the highest level. Tonight, we are honoring a group of individuals and their organizations who got together on an intentionally temporary but arduous basis for a few months last year to do the work necessary for our community to have local ownership and governance of Francis Nelson Health Center in order to expand access to care for the residents of As we told you at last year's annual awards dinner, there was a huge community collaboration underway to improve access to care for the medically underserved in our community. A coalition of organizations, including the United Way of Champaign County, Carl, Covenant, Healthcare Consumers, Land of Lincoln, Smile Healthy, and several others, got together to try to figure out how we could make this happen. They reached the conclusion that the first step for improving access to care in our community would be to expand the capacity of Francis Nelson Health Center to serve the medically underserved. There was tremendous potential there, but unlocking the potential meant gaining ownership and local governance of Francis Nelson so it could better meet the community's needs. Local ownership and governance would also pave the way for more successful collaborations with other local organizations to make the full range of healthcare, mental health, and dental services available to current and future Francis Nelson patients. Once the coalition made their decision, a new organization had to be formed, led by a transition board of directors. Several organizations and their representatives stepped forward for what would become a tedious, legal, technical, exasperating, exhausting, thankless, Herculean, heroic task. All true. All true. Promise Healthcare was formed, and thanks to these individuals and organizations. The Promise Healthcare Transition Board set out to do the job of negotiating to purchase Francis Nelson from the Decatur Community Health Improvement Center, and also laying all the groundwork to make sure that the new organization and its operating board would meet all of the federal requirements of the government that govern federally qualified health centers like Francis Nelson. So, in order to accomplish this is what the organizations had to do. They each contributed funds to hire consultants to give them expert guidance along the way. They gave a lot of their time, a lot of their time, a lot of their time. This group of individuals, we all know what it's like to have extra meetings at work, right? This group of individuals met weekly from April 18th, 2012 through August 6th, 2012. That's 16 weekly meetings with lots of work in between the meetings. They contributed meeting space. The United Way of Champaign County hosted many of the meetings. The Land of Lincoln Legal Assistance Foundation also provided meeting space and teleconference technology, even for 3 months after the transition board finished its task and the new Promise Healthcare Operating Board was formed. We're never going to know all of the work that they had to do, but we do know that it involved legal and financial negotiations with the Decatur organization, negotiations with the federal government, developing and adopting about 1 million different policies and procedures required by the federal government. You know how that works. Finding the right mix of individuals to meet the federal requirements to serve on the operating board for Francis Nelson, getting them ready to serve when the time came, and, you may recall, dealing with public and media perceptions, and I must personally say misperceptions of what was going on with Francis Nelson, because I attended some of those meetings as well. So in a few short months that I'm sure felt endless at times, and working under the radar and without any fanfare, this group actually accomplished what it set out to do. Before I introduce you to the individuals and organizations who served on the Promise Healthcare Transition Board of Directors, I want to tell you that they would be the first people to say that they could not have accomplished their mission without the extraordinary work done by two key individuals who served as paid staff during this time. And these individuals are Nancy Greenwald, who is the Executive Director of Promise Healthcare, Deb Frank Finan, who served as the attorney for Promise Healthcare. We definitely want to thank them also. Now, I ask you to join me in recognizing the volunteers who served on the Promise Healthcare Transition Board until the mission was accomplished. Several of them could not be with us this evening, but as I call your names, please wave your hands so people know who you are. Not able to be here this evening, but we want to thank Mark Ballard of Bank Champaign, who served as the president. Lynn Barnes of Carl Foundation. Kathy Emanuel, who's president of Covenant Medical Center. She's not able to be here. Lynn Jones, formerly of United Way and now of Carl. Beverly Baker, representing the United Way of Champaign County, who provided extraordinary leadership to organize this. Valerie McWilliams, Land of Lincoln Legal Assistance Foundation. She was not able to be here tonight. Our own Paulette Coleman, who's a staff member of CCHCC and who served as vice president of the Jen Tiapchi of Champaign County Healthcare Consumers. And last but not least, a name and face that you recognize, Claudia Lenholm, served as secretary and treasurer. It is my honor to recognize your service with the Harry J. Baker Community Service Award, and we want to thank you all for your extraordinary work. This is the kind of thing that keeps communities going, especially even in our darkest days, and we want to thank you for all of the work that you've done to make it happen.